Hello, everyone. You are very welcome to today's webinar. I am Amy Graham and I work with the student recruitment at the Graduate School of Healthcare Management for the Royal College of Surgeons. You're very welcome to this special webinar, Leadership Lessons from Healthcare's Frontline, with our special guest speaker and alumni, Martin Dunne. Before we get started, I'd just like to ask everyone to mute your microphones and turn off your cameras, please. So I'll just ask you again, if you could please mute all microphones and turn off your cameras, we would be most grateful. So just starting in to the webinar, I'll just go through the house rules. Again, I'd like you to turn off all cameras and mute all microphones. Firstly, I'm going to start off by giving you a brief overview of today's webinar. I myself are Amy Graham. Today, our guest speakers are going to be Robert McMurray, the Academic Director of the Graduate School of Healthcare Management at the Royal College of Surgeons, as well as Cathy Doyle, who is our dissertation leader at the Graduate School of Healthcare Management with the Royal College of Surgeons. And our special guest today, as I mentioned, is Martin Dunne. And Martin Dunne is the current Deputy CEO of Lifeline Ambulance Service and a former Director of the National Ambulance Service of Ireland. And we are honoured to have him today. So to start off, firstly, I am going to give you a brief overview of the Graduate School of Healthcare Management. And as you can see from our slide here, the Graduate School of Healthcare Management ranks among the top 2% in Times Higher Education World University Rankings for 2021. We have been developing leaders for over 220 years. We are accredited internationally by the National University of Ireland. Here is a list of some of our resources. And as you can see, we have an abundance of resources for the Graduate School of Healthcare Management, such as a 2-week online orientation course, a Grammarly subscription, LinkedIn learning, and support sessions for academic writing. Here is a look at our map and a global footprint of our alumni to date. And as you can see, we have a large global footprint when it comes to our alumni. We have over 3,000 alumni, former students from over 29 countries across the world. And our vision for the Graduate School of Healthcare Management is to develop leaders and to nurture and support and discover new ways of improving healthcare management. So to begin with, I'm going to hand you over now to our academic director, Professor Robert McMurray. We're delighted to have him. Thank you very much. Hello, Robert.
Hello, everybody. I'm really pleased you can be with us here today. I hope it's sunny and a pleasant climate wherever you are. It is where I am at present, which always makes a Monday better, I think. So, as academic director of the Graduate School of Healthcare Management, it's my privilege to work with a great range of faculty and operations colleagues who are passionate about leading education that matters when it comes to healthcare and healthcare leadership. And management and organisation really does matter, as we're going to hear from our guest speaker today. It's never been clearer how you organise things makes a difference than when you look at COVID-19. For all the expertise and the brilliance of our scientists and our clinicians, if you can't organise your policies, your national systems, your supply lines, you really quickly discover that healthcare and the well-being of your population, and frankly the well-being of your economy, suffers incredibly. So managing really matters. It matters how we guide, direct and care for those who work with us. It matters how we engage key stakeholders, both traditional stakeholders and new stakeholders. And it matters how we deal with change, whether this be in systems, processes, relations or technology, change, conflict. We don't always like to talk about conflict, but it's a big part of organisations, and sometimes the disruption that comes from conflict can get us to new areas and new understandings. But we need to be able to negotiate that, and one of the things we've seen a lot of over the last 2 years, innovation. innovation in the ways in which we talk to each other, link to each other. I mean, arguably, COVID-19 has forced us to realize some of the promise of telemedicine that has been promised for 2 or 3 decades, but has never really materialized. So as a graduate school, I think part of our job is to challenge managers, clinicians, executives and policymakers in the public and private sector to engage with the latest ideas and the latest practice. So we're committed to research that expands understanding and drives learning, both for individuals and systems. Our research is aimed at tackling grand challenges like quality, leadership and systems. We focus on empowerment and well-being, and then emerging issues such as entrepreneurship, innovation and digital disruption, all with the aim of leading and improving health and health care. So what does that mean for people who might come and spend time with us, whether it's for an hour seminar like today, or a diploma, or a master's, or executive education? Well, it means that our job is to make you think differently about managing and organising as part of the university's mission to educate, nurture and discover. And in terms of education, we are specialists in providing you with the tools and concepts you need to look again at how you manage, so that you and your organisation can take the next steps. Now, sometimes that means looking at what you do and realising you're already on a great path. You're already doing the things that need to be done. At other times, and this will be difficult, it's about questioning what you or others are doing, and about raising difficult questions and looking for a new direction. And we certainly all do that. And certainly we've been doing that here as a school. So I like to think we live what we talk about, as we've transitioned from what was the Institute of Leadership to now the Graduate School of Healthcare Management. We also, and it's great having Kathy here, we want to help you discover how best to evaluate the massive information that is out there, while also offering the opportunity to make your own original contributions to management theory and practice. And so our dissertations, our organisational development projects, our co-design with executive work are all targeted at that, about letting you get your own learning in a guided and safe environment to look at the latest ideas and established theories, to critique those theories, to critique people like me, and to challenge us to show why things maybe work in one place and not another, and then to identify and develop best practice. And I've mentioned it once already, but it is worth saying that the value of a place like ours is that it's in a safe and supportive and nurturing environment. It's a chance to come together with some of the brightest minds, both within the college, but also in the networks of people that you'll be working with and developing with to develop yourself and your organisation. So healthcare really does matter. Healthcare management matters, and I think I'm so pleased and we're privileged to have Mr. Martin Dunne here to talk about his work and his experiences as the National Director of the Irish Ambulance Service and beyond that, because there is so much we can get from it, drawing on the experience of others, and somebody who I'm really pleased to say is an alumnus. So I know you're going to have a great session. Thank you so much for your time, and enjoy the time ahead.
Thank you very much, Robert. And we're delighted today to be back at the helm with Kathy Doyle, who is our dissertation leader at the Graduate School of Healthcare Management, the Royal College of Surgeons. Thank you very much, Kathy, and I'll hand it over to you.
Thank you, Amy, and Robert, thanks for welcoming me to this webinar. As you heard, my name is Kathy Doyle, and I am the dissertation leader. So this is a piece of work that the students undertake in their second year of their 2 years masters with us here at the Graduate School of Healthcare Management. And additionally, my area of interest is governance. So I teach that topic across our different programs to our students in year one. So I meet the students in year one when I teach them on the topic, and then I meet them in a greater detail in year two as I lead them along their dissertation journey. I'm a member of the academic faculty at the Graduate School of Healthcare Management. I have a master's in business administration, and I have an MA in education. And I specifically focused on leadership and management as part of my MA. So I think I bring those lovely leadership and management skills to my role at the graduate school. As I said, governance is my key interest topic, and I've actually taught it for many years. I've self-published a best practice guide introducing the principles and practice of healthcare governance, and I've written journal articles and book chapters. I'm really looking forward this afternoon to talking and learning the leadership lessons when Martin and I catch up in a few moments. So back to you, Amy, at this stage.
Thank you very much, Kathy. And before we begin into our interview session, I would just like to remind people to turn off all your cameras and mute your microphones. Thank you very much. And we are honoured and privileged today to have one of our alumni students with us, Martin Dunne, who is the current Deputy CEO of the Lifeline Ambulance Service and also the former Director of the National Ambulance Service of Ireland. And as you may have heard, Martin was at the forefront of the pandemic wave when it began in Ireland. And we're going to gain some insight into his leadership lessons during this time. So without further ado, I'd like to welcome Martin Dunne to our webinar today and to hand it back over to you, Kathy. Thank you so much.
Hello, Amy. How are you? Hello, Kathy. How are you? And thank you very much for the opportunity to say hello today. Greatly appreciate it. And thanks for the lovely introduction, Amy.
I'm delighted to have the honour, Martin, of the member of the team who will be talking to you and learning about your leadership lessons. So if it's all good with you, we'll get going.
No problem, Kathy. Carry on.
Okay, my first question. I was just thinking about maybe the key moments in your career. And then we could link that very nicely, maybe to your leadership lessons along the way. So would you like to start with that? So share some key moments in your career and the leadership lessons.
Okay, I suppose it's been a long career, Kathy, to be honest with you. So there's been several moments, if you want to put it that way. I suppose from early on in my career, the key moments would have been in relation to patient care and how to improve patient care. And that would include, as said, the usual delivery of babies maybe on the scene or whatever, etc. So they were all key moments and milestones as you developed. But in parallel to that, I always wanted to develop through the management stream. So as I was developing through the service, I was also developing up through the management stream, and I tried to make sure that I placed myself in every management position across the healthcare delivery system, like the ambulance services. Because when I started first, we were dealing with 11 health boards, which migrated across then to what you would call the Eastern Region Health Authority. And then that migrated again into the HSE, the Health Service Executive. So I would have seen a lot of change, I suppose, at that level too, in relation to the healthcare delivery systems. So as part of that, as I said, I wanted to develop myself and work through it. So I suppose some of the key moments would be, I suppose, when I got as far as already introduced, the Director of the National Ambulance Service of Ireland, which gave me strategic and operational responsibility both for the day-to-day running, but also the development of an ambulance service on a national footprint. And one of my first jobs was, I suppose, to make it a national ambulance service and look at all the requirements that were around that. And I suppose if you take that, some of the key milestones around that too were looking at how we were going to do it, delivering a plan, setting a strategy, communicating that strategy out to people to see where we were going to add value to what we were doing and add value to the patient as well as the system and everyone that was involved in it. So, I mean, we had 13 control centres. So we had to look at a plan around that to migrate that down or transition that across. So we agreed, having done a lot of international research, was 2 sites or 2 control centres, but sitting on a singular digital infrastructure, which meant we had to introduce what we would call a digital workspace, a digital workplace, to allow people to be able to act on a national basis across the whole country, receive the calls, access the calls, review the calls using various systems, and then pass them calls seamlessly out to the appropriate responding resources. So there's a lot of work in that. That involved a lot of staff engagement. I suppose we moved on then in relation to, so we got that piece done. So then we had to look at the delivery aspect of it, which is the equipment, the vehicles, and the education. So we had to look at designing the vehicles that were fit for purpose. That included stakeholder engagement. It included HSE engagement. It also allowed me to access, I suppose, key decision makers, both in the Irish government and indeed in the Health Service Executive itself, to make sure that the plans and the strategies we were putting in place actually were going to be funded to allow us to deliver that type of service. We also then, I suppose, looked at the equipment aspect of it, and we had to introduce the same digital workspace into the ambulances. So all the ambulances now became a digital hub with 2 Wi-Fi hubs in them. One particularly for the job, but also because of the new people coming in, maybe one of the more mature ambulance people at the time, all the new entrants coming in would have a huge reliance on the World Wide Web, all sorts of social media platforms. They like to access things very rapidly. So we had to give them the facility to do that as part of the development through a people plan as well. And then education, and Robert and yourself mentioned it earlier on. Education, as distinct from training, shall we say, is the bedrock of everything that we do and how we were able to deliver a service. So I was able to introduce actually a BSc into the National Ambulance Service as well. So all medics coming into the National Ambulance Service have a BSc through ECC. So they were all key moments. I suppose coupled with that too, because of the fact we were able to develop in such a way, it gave me access, or gave people actually probably more access to me on more of a global stage as well, if you wanted to look at it that way. Because part of everything you do is open your paradigms, as I was told very early, and explained very early too by the RCSI as one of the very first modules we sat in, probably the very first lecture I sat through on the very first day. I had to ask the silly question, what was the paradigm? And it was probably one of the best questions I ever actually asked in the RCSI, and I got a very, very good answer, which to this day I've never forgotten, and has allowed me, I suppose, to open my mind, open my paradigms, and look out and look around and do some broad scanning and bring it all together. So I was able to get access then to the likes of, well, we were asked, I suppose, to assist with other ambulance service deliveries in line with the model we did. So we worked with Georgia, we developed an ambulance service with them over there. We've worked in the UAE extensively, and we've worked with the Higher College of Technology over in Dubai, as well as the Dubai Ambulance Service and the Abu Dhabi National Ambulance Service over there as well. I've done a lot of work with Northern Ireland Ambulance Services, and I did a bit of work lately with the NHS, both E and I, as they were, and had a critical friend input into a recent publication by Lord Carter in relation to the efficiencies of the ambulance services in the UK. Right, so I suppose I've had a lot of, from my point of view, starting off as what we would call an ambulance driver many years ago, to be now a full-blown paramedic, but also the director of the National Ambulance Service of Ireland, and influencing and adding value how care was delivered to our patients and how care has been delivered to other patients on a global footprint. I don't know whether that's...
Oh, Martin, super. I just wrote down just some of the things you mentioned, and then you started with patient and patient care. And we talk about in Ireland our strategy for patient care. So it was wonderful, regardless of what a role of many of the people who are here with us today as healthcare professionals, to have that patient at the centre. And that was really, really lovely. Then you moved on and you were talking about stakeholders. You didn't actually use the word like change and organisation development, but those key stakeholders that you communicated with within your organisation as you looked at having a national health service with 2 centres, and how you communicated and came up with the strategy to move the service forward. So that concept as leaders and knowing your stakeholders, those internal stakeholders. And as you spoke, to me, it was like a stone dropping in the water. And the first rip, I see smiling, because I always try to put a picture sometimes when I'm talking, so that the stone goes in, the stakeholders that were closest to you. As you got more senior, and when you were the leader and the CEO of the National Ambulance Service, I suppose your senior team and those you would have worked very closely with. But then the stone and the rippling in the water is going out and out. So it's beyond the Irish Ambulance Service to the, and I'll talk to you about Northern Ireland again in a moment, to the Northern Ireland Ambulance Service. And then I suppose as an evidence of excellent practice, you and your team were invited to different countries around the world to share our model, our model of delivery as you say, of paramedic services, and also in the education piece, building on that, the BSc that you developed for your team that you have. So I can see the importance of knowing your stakeholders, knowing the stakeholders that are close to you and the stakeholders that are further away. So thank you so much for talking about that. And that to me was the key takeout of maybe one of the lessons that you talked about would be about the stakeholders.
Yeah, well, it probably would be is right. I mean, stakeholders, first, and you said it correctly there. Mother Teresa mentioned about dropping a stone into a pool and how far the ripples move out and move across, right? And you're correct and right. You need to be very quickly identify who your stakeholders are, but you also need to know where you're going and who you need to bring with you on that journey, and you need to map that out. And then that allows you to do your stakeholder engagement and your stakeholder mapping. And a lot of those stakeholders are both internal and external to the system, and they all play a vital and important part. And another bit that hangs on the back of that then would be the communication. So you need to be able to communicate quite clearly your vision, right? Your understanding on where you're going and how you're going to get there, and how the stakeholders can support you. I also found too, though, Kathy, if you show that you're adding value and that you show that you're going to deliver, right, the stakeholders will support you, and they will come with you. And that has happened. And we were lucky enough then, as you say, in one way, I suppose, to get a reputation for delivering, which meant the major stakeholders, because whether we like it or whether we don't, funding and support from the highest levels in government in Ireland is critical, and anywhere else. And any other job, it's immaterial whether it's healthcare delivery or anything else. It's the process around it in the main is the same. So you know where you're going yourself, and you know what you want to get done, and you need to communicate that clearly, and then by the people. Emotional intelligence is people who say win their hearts, and then show them your intent. And I think, yeah, we were lucky enough to get there and add a lot of value to a lot of other places, which has been greatly appreciated by the other places we went to. And it's good for us too, because we learn, and I learned, because everywhere you go, wherever you go, you're going to learn something. Early on in my career in the RCSI too, a wise man said to me that Socrates once said, well, it's reputed that he said, right, that he's the wisest man in the world because there's one thing that he knows, and that one thing is that he knows nothing, right? Now, you don't have to take it literally to the extent that you know nothing, but it means that when you go in with your paradigm open, going to somewhere else, there is history and there's culture, right, in the places you're going to that I, maybe coming from where I come, wouldn't be fully aware of. But the people there are, and they're probably proud of it. And there's no point in going in somewhere to say, well, as far as we're concerned, what you've been doing for the last number of while really isn't good enough, and we're going to tell you how to do it. You're on a hiding to absolutely nowhere very fast, right? And that's one of the lessons we all learned as well. So you need to respect all that and then work with people and bring people with you. That's what I found anyway, to be honest with you.
So don't always come with prior assumptions. And that building on your Socrates quote, to ask those questions, to seek to learn and to build your knowledge. Yeah, lovely, Martin. Yeah, that's a second lovely tip.
No, but it was said too that our organisations are littered with the debris of yesterday's change initiatives.
Yeah,
so you have to sit down and say, well, why is that? Like, what is the point in embedding change, in putting change in, if you're not going to embed it and then move on and add value? Sorry, go ahead.
No, and you've just mentioned embedding change, and when you first started talking, you talked about all the changes in your career as you went through the National Ambulance Service. And then I'm thinking of you as the CEO and leader of the National Ambulance Service and the changes that have been applied over the years. Have you some tips to share with our audience on leading and embedding, going back to that word you used, embedding the change? So we want to make sure, having gone to this bother, that the change is going to stay with us. So some tips that you can share.
Again, it goes back to some of the same basic principles that I learned actually through my master's, to be perfectly honest with you. I found my complete master's through the RCSI a very, very solid foundation from an educational point of view moving forward. And I use a lot of the skills that I was shown through the RCSI as I progressed through the system, right? And again, go back to keep it simple in a lot of cases. So understand yourself. That's the first thing, right? And I can be a bit of a challenge. So I need to understand myself on a regular basis, right? But you need to understand yourself, and then you know your limits, right? Then you need to understand the people around you as well, and it's part of a team building exercise. But very clearly, you need to know what you want to do and what's the question maybe you want answered, put it that way. And then you develop around that. And we can use the word strategy, or you can use a plan or a business case. It's really immaterial, but it is something that you can put down to work out as to we're going from there and we're going to there. And here's the route we're going to take. And when you communicate that route out to your team, and you have to understand teams again are more dynamics, and you need to look at your team in some cases to make sure that people are in, I won't say the right fit, but in some cases people are in places that they don't think they can add the value to. But if they were in another part of it, they might be able to add a lot more value. So then you have much more buy-in. So you need to be open with your team, talk to them and ask them from their perspective. And you get some frank answers in a lot of cases, right? Where you think you should be going and what change you need to do, because you're looking to embed the change. So then you add the value and you explain it quite clearly. And then you need to go to the other stakeholders and make sure that they're accepting this type of change and they're prepared to support it in whatever resourcing you want to use, whether that's people, money, vehicles, equipment, or whatever is required, that they're there to back that up. Because if you don't have that, and you need to, in some cases, you need to cost it, value it over the number of years that it's going to take you to do the change. So there's no surprise anywhere, right? Yeah. And if it's impacting people, sometimes, unfortunately, there can be perceived maybe negative impacts on some change initiatives, right? And you need to buy those people into the change initiative, sit down, discuss it with them, and give them a level of confidence to say, okay, there may be change here, because we're all up for saying change as long as it's not me, as you know yourself. So we're all saying, yeah, we're all up for change as long as it's not me. And then the second question is, well, how is it going to impact on me, right? I know we're doing the value, but how is it going to impact on me, right? And you need to remember that, because we're dealing with human beings, and human behavior is human behavior. So you need to engage with those people. Sometimes it's unpleasant, but you need to show them options, or you need to show them where they're going to be part of it, and get as best a buy-in as you possibly can. That helps then sustain the change. Do the change in incremental ways that people know the day, because people like to have confidence to say, on today, the 20th of September, we're going to do this as part of the whole model or the program, or whatever you want to put it, right? And they expect it to happen on that day. So you need to put everything in around that, including resilience and redundancy, or whatever is required to make sure that on that day, that part of it actually happens the way we all agreed it would. And then there's a bit of redundancy or resilience just in case there could be a glitch, and there always will be a glitch. But make sure you're prepared as best you possibly can for it and react to it in a proactive manner and sort it. So I think once you get all that into it, the change, as I said, we reconfigured 13 control centers, which is a lot of people and a lot of rooms and a lot of technology, through a very detailed plan. There was a PID done, project initiation document signed off. But some people, that was affecting people's lives and people's work that had been there for a number of years, and we were changing it ever so slightly, maybe from their point of view. And they needed confidence that they were going to be part of the change, and they were going to be valued for what they have done and what they're planning to do.
So what I'm hearing, the planning for change is important. However, the engagement and communication with the staff, sharing, the value added, and think of the value added from the different stakeholders who are involved, is also really, really important if you want the change to be successful and to embed it. And then I also liked, Martin, where you talked about how people like to know, when is it going to happen? How is it going to happen? How will it impact on me? What will my role be? And we can do this in little incremental steps. They don't always need to know the big giant picture, maybe at the early stage. And then staff feel valued. And would that have been the elements of the success of that very big project you did, where you changed how the ambulance service within the country of Ireland turned into a national service, where you established your 13 centres?
Yeah, I mean, we clearly outlined to people. We had stakeholder engagement meetings, we had staff engagement forums, etc. giving people the opportunity to air their views in adequate time, not the day before, by the way. I'm talking about over a time scale that was, I suppose, practical in relation to their position, right? And then, yes, and then they added their value, felt confident, and felt that they were going to be part of it, whichever way they wanted to be in the main, to be perfectly honest with you. Now, sometimes you have to make decisions have to be made, and that's part of management, it's part of leadership. But as long as you're making the right decision, and people know the decision's been made on the proper principles, and it's fair, and it's also equitable. So there's no special arrangements behind the scenes for the other person that didn't know about it, right? Yeah. So then everyone feels they've been treated fairly and honestly and openly. And that helps embed it. And then that becomes the norm. And as you say, then let's move on to the next piece. Yeah. And there was another part of that was very important too. So some of the change involved complete new systems of working, right? So you were going out on an ambulance call or you're in the control room on X system. As you were coming back from that ambulance call, you were on Y system, which was a totally different digital infrastructure, right? So you do the education, you do the training, and then you press the button at 4 o'clock in the morning or whatever it might be, picking the optimal time to make sure there's minimum disruption. But then there's always the possibility that not everyone can actually 100% remember exactly all the new buttons on your new Sky remote and all that, etc., and everything else, because you went from an analog to digital, and there is a little bit of a difference. So you need to have people available and on standby and ready to react there and then. Well, we did. We don't have the option to say we'll call you back in 4 hours or whatever it might be. There and then to make sure that the people coming back from the call on the different system could access the support if they just weren't comfortable with a little bit of the new system and the buttonology, whatever it might be. And we've always made sure that was there and available 24 hours a day. And that again helped. So there was no surprise.
And as you said, there was no surprises.
Yeah.
Let's move on a little bit now. I think we can't have a conversation without mentioning the COVID-19 pandemic. And when you started talking at first, you mentioned your role and the contribution to do with Northern Ireland. And for many of our international people who are here today, just to share with those that the island of Ireland is made up of the Republic of Ireland, and outside of that jurisdiction, there is an element in the country. So Martin, will you talk to me about that collaboration piece that you did during COVID with Northern Ireland and how you added value? Let's go back to the added value that you were talking about a moment ago.
Okay, and again, I suppose it's back down to what we talked about earlier about relationships and relationship building, but also known people. And we having the option as a national service, because there's only 1 or 2 in the world that are actually national, right? For me to be able to engage with other people. So I was appointed to what they call the Association of the Chief Executive Officers of the UK Ambulance Service Trusts, and I was part of it. So I got to know all the Chief Executive Officers in the UK, and my Northern Ireland colleague I got to know quite well. And in fairness, as you say, there's a bit of a puddle between us and the UK, but there's no puddle between us and Northern Ireland, right? There's actually a straight road now, called the M50 onto the M1, and it brings you straight into Belfast. So, I mean, our core function at the time, our core function is to deliver pre-hospital care, right? Safely, appropriately, and timely. And the common denominator in the middle of this is a patient, right? So, like, regardless whether you're in the UAE, whether you're in Georgia, or whether you're in, I was in Las Vegas at one stage doing a talk over there, right? It doesn't make a difference. But still, it's people, sick people who, in the main, always remember, they actually don't want to see an ambulance pulling up outside or pulling up alongside them, because it has a connotation that things could be better, if you want to put it that way, right? So they don't want it, but they know they need it. And there's a difference, right? So the people that are arriving there have to immediately, whether you're in the north or the south or anywhere else, when they step from that vehicle, it's a box of quality street. That's what I used to say. So it's good from the top to the bottom. So they come off the vehicle knowing what they're going to do. They have the toolboxes delivered, and they show the confidence from the education point of view. And the patient knows that these people know what they're at. So they can relax a little bit, and everything will be as best as it possibly can. So during, of course, of COVID, naturally enough, there was an awful lot of different demands placed on all our services, right? The National Ambulance Service had to step up very quickly and introduce the swabbing, which means there was a complete new educational Moodle for them had to be delivered in 2 days. All sorts of PPE had to be sourced, etc., to allow us to do what we were doing. We were swabbing 5,200 people a day at one stage on behalf of the HSE across the country. Our colleagues in Northern Ireland were under more pressure in relation to other influences that were going on up there. And in fairness, they were starting to find it difficult to what we would call maintain their existing level of service, or what would be the norm to hit the demand. So the capacity was starting to outstrip their demand. And because we have working relationships quite well, we have radio communications infrastructures, and we were able to offer assistance. So not only were we looking after, as you say, our existing level of service down here and making sure the Irish patients were getting the appropriate, as well as doing all the other swabbing, testing, whatever the words you want to use, across the country. And we were able to assist our colleagues in Northern Ireland on a regular basis for a period of time by allowing our ambulance crews to go up there across what we would call the border, but there's none, if you know what I'm saying to you, to do what we all do, which is deliver care. It was extremely well received, particularly by the patients that they met. There was even presents delivered into the ambulance stations in Northern Ireland for them. They were clapped, etc. So there was absolutely no issue with anything, if you know what I'm saying to you. But because we all do the one job, and there's people to be looked after, our crews, in fairness, and ambulance crews in the main always will step up to the challenge. Once they have the toolbox and the support to do it, they will do it. So we did that. Now look, there was a lot of planning, there was a lot of logistics, there's a lot of equipment. So if they use their equipment in Northern Ireland, how do we replenish the stock? All that. How do we fuel our vehicles? How do we get the crews looked after from a feeding point of view, a rest point of view? That all had to be factored into it, along with everything else, right? And then how do we make sure that the calls are being passed safely and appropriately? And how did they get there, right? So like that was all built into what we did, and it worked quite well. Yeah, and it's good to have that collaboration, because our crews then appreciated it. They made friends. You know, at the end of the day, they made friends, they met colleagues, but the acquaintances went out to turn into friends. So like it was a positive experience for everyone. Busy, demanding, and timely, but it was delivered.
That's a great story around leading a collaboration at a time of need, and very, very much patient-centred, and look at the value that our Irish ambulance service offered to our very, very near neighbours. So thanks for that.
No problem.
Martin, I heard a great story, and it was a colleague of mine. I explained to my colleague that I was going to be chatting to you today. And this colleague, he shared with me that he scheduled you as a day in your life. And he told me about how having the air code addresses for home locations actually transformed the timeliness to which paramedics could respond to a 999 call. So would you share this story? He didn't tell me the whole story. He said, Kathy, you ask Martin, he'll tell you. And the whole thing about the integration of technology, and it seems to be a theme throughout what we're talking about today. So the integration of this national technology, nothing to do with healthcare, but how it was embraced by the National Ambulance Service.
Yeah, okay, it's good. It's a very good question, and it goes back to the start of the reconfiguration when I talked earlier on about the control centres and the infrastructure and the digital workspace that we had to develop for staff. I suppose, like we could talk for hours on this. You have to understand. So to develop a digital workspace, not only were we developing digital tools to do it, but we decided we'd be future-proofing everything that we were doing. So all the systems that are in place can react very quickly to any positive additions without having to go through, shall we say, a prolonged, or maybe be told your system is not up to standard to be able to accept new technology. So there was a huge amount of thought from a technology point of view, which I'm not good at, but there was people in my organization very good at it, right? And so we developed, as part of that digital hub build, we had to develop a new, what they call CAD system, computer-aided dispatch system. Quite an expensive piece of equipment. You do your fleet mapping around it, and a lot of stakeholder engagement as to what we would do. So it was agreed at the time that everything we would build would be future-proofed, and that particular system, whilst it's sitting on two sites, is hugely future-proofed, right? So when the air code system came in first, and the National Ambulance Service were immediately able to accept it, right? There was no question of it not integrating or interfacing, whatever the word is, with the system, nor interfacing with the vehicles. So what happens is, as soon as someone dials 112999 in Ireland from a fixed premises, And as you probably know, you said it yourself, air codes donate a building, right? Which there's a whole other conversation about if it's not a building. And I can talk about that if you want as well as part of the system, right?
Yeah.
So the air code then, as soon as the patient, the question is asked, do you know your air code? So as soon as the air code is entered into the system, what automatically happens is, the technical term now is a hit, right? So we get a hit on the address, right? I suppose it's not the best word to use in a medical infrastructure or a medical, but it's a hit on the address. And that highlights that address immediately. So we don't need to go any further with directions. We don't need to, because people dial 112-999 are usually in the norm in a heightened level of concern. They're in an area that they're not comfortable with. Sometimes they can't remember their name, never mind their address, right? So that's why the air code, a lot of people, particularly now, a lot of people know it, or to have it stuck beside a phone, or to have it on the phone, or whatever it might be, which means you don't have to ask any of those what they would think are silly questions as to, well, how do we find you, right? In the middle of Dublin City, or wherever it might be, or the middle of Cork City, they would expect that we know it. So the air code gives you that hit. That allows that hit to go straight across to what they call the MDT, the mobile data terminal on the ambulance. And the crew get a beep to say, got a call, they press accept, and then it maps from where they are to that address. So that means all the conversation, shall we say, about, well, turn left at Martin's shop. Well, Martin's shop's not there anymore. It was there 10 years ago. Do you not know it? Or go around the corner and the light will be on outside, and you're going to, it's 8 o'clock in a winter's night. Most houses have the light on outside, or whatever it is. So that's all gone, and we can get there very, very quickly and very, very safely. And the caller knows, because then we can tell the caller how far we are away, and we can tell them on a continuous basis, they're just coming around the corner to you now. Maybe you'd open the front door, the vehicle's just pulling up outside. And that gives them a level of confidence that help is actually, and really, if you know what I'm saying to you, on the way to them, right? So that works extremely well, and it takes valuable time away from the dispatch process, because everything is time when you're dealing with a sick patient. So the next question was, well, if it's not a house, or if it's not a fixed building, what do you do? Get out of that.
My question, if it's not a fixed building, what do you do?
So then the next thing is, as part of the build of the system, we looked at that, right? So there's a couple of ways. Well, Ireland was one of the first countries in Europe, as from an ambulance service, to introduce what they call AML, which is Advanced Mobile Locator. So if you're using a mobile phone, we can now find that phone to give or take a circa five geofence of about 5 meters, give around it. So we can home in the phone, and the system can do that. If that's not good and you're on the motorway, right, and it's not working, we can actually then put another thing called Find Me, which is a HSE NAS invention, where we can ping the phone, and it'll actually send back the lat-long coordinates from the location of that phone back to the control room. And they use that very successfully in relation to the helicopter dispatch in the control center when it was there, right? So they can find it that way, okay? And then we have another thing called Locate 8, which then allows us to look at, say, low bridges. If you notice, if you walk down the canal now or anything like that, most of the buoys and the rescue things, the buoys you throw in, have numbers on them.
Okay, yeah.
That means we can find that number, and we can map that number, and we can find a wind turbine that'll have a number on it, and it can be mapped. And that's all part of the long-term evolution, if you want to put it that way, of the ICT infrastructure. And it's because every day it's changing. So it gives us different ways of being able to find the people as quickly as we possibly can, and then the vehicles on the way to them as quickly as we possibly can. So every time you ask a question like how many calls do you do a day, that type of question could go on for half an hour because there's always other parts to that question.
Of course, yeah.
And that's what I said to you earlier on when we talked about strategy. And I know people don't like in the main the word strategy, business case, but what's the question you're trying to answer? It's very important to get to that point. What is the question? Now let's answer that question, not the other question or the one we thought we might have been asking, but that question, and expand on it then.
Yeah.
Sorry, I could go on too much, Kathy.
No, Martin, that was so eye-opening. And I thought of, when you mentioned future-proofing as a leader, the importance of future-proofing. Don't only think of today, think of 5 years or 10 years in the future. And how, because you had a future-proofed technology that you introduced, you were able to integrate it with the air code systems. It sounds like the engineers and spatial planning, and so working with so many of the different government departments in the bigger picture around people and people safety, and the speediness of which you can get to a patient in need of a paramedic care. No, it was a great story, really innovative.
One of our call takers, one of the NAS call takers 3 years ago won an award for rescuing a patient on a mountain in Greenland from Tala.
Oh, fantastic.
So they were able to coordinate the complete rescue setup from the location, from the control center in Tala, via their dad, who lived in Tala, across to the rescue services in Greenland, to launch a helicopter over there, to be able to pinpoint for the helicopter in Greenland from Tala exactly where that patient was from the ping on the mobile phone. And they had to be rescued off it because they were hit by a snowstorm. But so it does work on a global basis if it's there. So it's all systems.
It is, and example of technology as being the enabler.
Correct.
And realizing the capability of it. Yeah, thanks for that Greenland story. Martin, I believe you're interested in sport, sort of, and would it be rugby especially?
Yeah, well, I used to try. That's the wrong term. Rugby, but I used to try. Yeah.
So not only as an armchair sports person, but also as a player, what lessons do you take from sport as a leader that would be of help and have helped you in the workplace?
Yeah, it's a very good question, Kathy, to be honest with you. And as Paul O'Connell said to us one day, you deal with the rock in front of your face. That's what Paul O'Connell had said to you. He's a rugby player, plays for Munster and played a bit further. But he's a great believer, dealing with the rock in front of your face and deal with it, right?
Yeah.
If you look at a team, and I'll give you a good example of it now in a second. Any team, whether it's a football team, a hockey team, a rugby team, has X amount of players and a captain, right? So let's look at the captain's role and function. So the captain of the team has to make the decisions. The captain of the team needs to communicate to the team. The captain of the team needs to motivate the team. The captain of the team needs to show his or her commitment to that team and their focus on, and I don't like saying this, but some people say it's about participation, but about winning the game, right? Whichever game it may be. And that's what the captain does. But in the middle of all that, that captain, he or her, is an integral part of the team, right? And plays and works with the team and is expected by the rest of the players to be that part of the team, even though they have it. So there's always, from a sporting point of view, it's a great analogy to use, because you're out there as a team, but there is one person who has to lead that team, and that's their responsibility. But they also have to be part of it and embed themselves in the team. And again, if you want to go back to emotional intelligence or whatever, win their hearts, and they'll work with you and they'll follow on, And again, if you go back to the dressing room before they go out, the captain will try and motivate and communicate everything that the team needs to know to give them the confidence to say that when we're going out in this pitch, we're the best, and we're going to win this, and we're going to do our best for ourselves as well as everyone else. And that's very important. And it's also great for communication. And as I say to an awful lot of people, that anyone that's thinking about playing sports, they should. Because no matter where you go in the world, even if you go over to Pakistan, right? And I was there at one stage, I mentioned to you, right? I was able to play. Well, it was actually rounders they were doing, right? But it's close enough to a bit of hurley stick, give or take, if you know what I mean. So I was able to engage with them, and we were able to have a bit of game. So, and there's always people who will help you there and engage with you very quickly, no matter where you go, if you have a level of sport orientation. And if you look at, I don't know whether you've ever seen the Barbarian team. If anyone's on here now from anywhere, if they Google it, the Barbarians are allowed to come on the pitch wearing all different coloured socks. And that's not for the crack, right? That's showing that the team is made up of a diverse bunch of people from all different areas and different other clubs, etc. And they're allowed to wear their own club socks onto the pitch to say, well, this is who I come from actually, right? But the jerseys are all the same, right? So the jerseys are donating the Barbarian team going out to do a job, but there's always this place, and appropriately so, for local initiative. There's always a place for local communication and local buy-in. And that's acknowledged by allowing people to wear their own team socks as part of the kit going out to play. And they play quite well when they go out.
I didn't know that about Barbarians. Next time I'm watching them playing, I'll have a look for the socks and see can I recognise any clubs. I've one last question, Martin. And I'm going to bring you back, because the first time I met you, you were a graduate student at the Graduate School of Healthcare Management, and you were in your first year of your studies. I was introducing clinical governance to the leaders on your program, So what enticed you to come and study at the on the MSc in Leadership and Innovation program? So I'd love to hear, like, so what was the driver to come and study, say?
Well, I suppose if you go back to, I think it was Henley said at one stage in Invictus, what did he say? I'm the master of my faith, I'm the captain of my soul, right? I had now got to a position of the director of the National Ambulance Service for Ireland, and it was my mission to make sure that the National Ambulance Service for Ireland, as far as I was concerned, was going to be the best ambulance service in the world. But not only that, but to deliver the best care to the patient, because that's what it's about at the end of the day, right? And I suppose, as I said to you earlier on, my skill set was a learned skill set, shall we say, as we moved up, both particularly through the management sphere. And I was trying to make sure that I was able to put myself in a position that I was able to lead appropriately and properly by having a good level of education at that level that was A, number one, recognised, and B, that I was able to access from a very busy environment, right? And I suppose from the first day that we contacted the RCSI, I found them very, I won't say, I suppose family is too loose of a word, but it was immediately welcoming. It was also immediately understanding of, maybe I would have been one of the more mature students on my class, on my course. There was a recognition of that. There was don't be worrying about it, we're here to support you a bit, which is very, very important. And the understanding of the environment that I was in at the time was quite busy and very dynamic. And I was going to have to be able to do my job, because we wouldn't be released for the length of time. So you go on your couple of days and you have to stay doing the job as well as do the masters, right? So there was a very much an understanding of how that would be supported and how I could go for support. Again, I suppose when you go into the environment, there's from my point of view, and I can only talk from my point of view, Kathy, as you know what I mean, it was a warm environment. It was an open environment. And again, I'm a kind of passionate person about that, and I do, but you could see the passion in any of the faculty that you'd meet, that they wanted to make sure that you got educated, as distinct from trained, as I said earlier on, that you could put a good foundation for yourself in place and put you in a position that you had the confidence when you were leaving there that you would be able to lead going into the future. And the skill sets that they were more than willing to impart to you. And Kieran O'Boyle was one of my chief professors at the time. If you ever asked me, he did say I was a bit of a challenging student for a while, right? There's no point in saying anything else. But that challenge was always supported and met with warmth and happiness, that we'll do it, we'll get on with it, you know. But then again, you have to do your work as well. So, like, I suppose, I don't know whether that's maybe exactly what you wanted,
No,
but I mean, the lean on the passion to educate people was infectious as far as I was concerned, and that's what drew me into it. And as far as I'm concerned, I was right. But that's my opinion again. And
Martin, we were delighted to have you. I never heard you were a challenging student, but hey, listen, you just said it. And we were delighted that you completed your 2 years and that you graduated with your MSc in Leadership. Mark, I can't believe the time has gone on. I could have kept asking you more and more questions. That was a super 30 minutes or more having that chat with you, as though we were drinking a cup of tea together.
Thanks,
so on behalf of us all, I say thank you, and I'm going to pass back now to Amy. So over to you, Amy.
Be safe, Kathy. Thank you.
Thanks, Martin.
Hello, Kathy and Martin. Thank you so much. I feel like I've had a crash course in leadership there, and stories of rugby as well, and Munster rugby, no less. I'm delighted to hear that. I think we'll open up the floor now to questions from the attendees, if there are any. You can raise your hand if you have any questions for Martin. We would love to hear from you. Just give it a minute. I have just one question for you there, Martin. You were going on about the importance of local communities, and just going back to the pandemic when you were starting out. I believe you as a team with the National Ambulance Service, you covered 93,000 screening tests at one point. And how important was it for you to sort of work with the likes of the local GPs and the communities?
Yeah, very important. I mean, the healthcare delivery is a system, right? And that system, it works across everyone. And once you have the patient sitting at the center of it, you're going to deliver the best you possibly can. So there's not one part of that complete entire system that's out there that is autonomous, right? And in the times of crisis, actually, I suppose at any time we would engage quite openly, the NAS would, I should say, engage very openly with GPs, public health nurse, mental health specialists, etc., because we kind of bridge all of those specialities out there as part of what we do every day of the week. So, I mean, there was I suppose, an unknown at that time, maybe, if you want to go back to that far, to say there was an unknown something floating around in the ether that was having a negative effect on people. And we were just trying to get to the bottom of what it was. And everyone came together to make sure we did. I mean, not only did I engage with GPs, but I mean, we had a huge amount of engagement with the military through the Department of Defence. We worked very closely, and they gave us resilience and support and redundancy in some cases. We had dental hygienists out, we had dental nurses out with us. We had all other people who were at the time probably in a space that, because of the COVID pandemic, some of the things they were doing weren't just as required. And they came and we put them through an educational process on a Moodle site, show them how to look after themselves, how to be safe, donning and doffing, etc., organize transportation, or whatever was needed to get them to where they needed to get to do the testing, or whatever part of it was required at that time. And we all worked together as a complete tight, I suppose, solution to the system at the time, you know. So it's hugely important. And there's no borders and there's no barriers when you're dealing with people, sick people. There never has been, to be honest with you. I know people would perceive it, but actually, if you're dealing with people who are sick and they require help, I don't know any of the public safety services in this country who hesitate at all. I mean, the Gardaí were working with us as well. They're trained community first responders now as well. They were out. We used to operate, well, they still do, the NAS do community first responder schemes all across Ireland, who are volunteers in their own town or their small community, who respond to cardiac arrest, etc., in the first instance immediately with local knowledge. Because of the severity of the pandemic, we had to actually stand those down as such, but they stood up again and they did different things. So they started looking at PPE, and they were moving PPE, they were moving food, they were moving all sorts of things like that to where it was needed for us to carry on and do the job. So they still stayed part of the system, which was excellent.
Great. And just another one, Martin, in terms of just the COVID-19 and leadership lessons, what I suppose are the most standout leadership lessons that you learned in your career during that time?
I suppose don't take anything for granted. That's the first thing, and it's a continuously changing landscape. So make sure that when you're planning to know that this is going to have to be changed. This cannot be set in stone. You need to move back to the rugby, deal with the rocks in front of your face at this moment in time, but be ready for it to change. So always make sure that the planning is flexible enough and broad enough to make sure that you can move and change quite quickly to the environment as it changes with you, and then to be able to communicate that out very quickly.
Great. Thank you so much. And Kathy, did you have a question there?
I just saw a question, Amy, here in our chat.
Sure, great.
Martin, a participant who's here, what they've asked is, how did you keep the team motivated, especially at those early COVID times? I suppose when the changes were happening quickly, we weren't getting to embed and we were introducing new. So what about the conflict and obstacles maybe that came with COVID?
Well, I suppose the first thing, it's amazing when people identify that we have something very unusual going on here, right? And the system needs to stand up as best it possibly can. And the challenges and the perceived obstacles that we be dealing with every day are diluted very quickly, right? And the teams, in fairness to all the managers out there, like, all stood up immediately. It wasn't a question of not playing on this pitch. It was a question of what we can do, how much can we do. And there always would have been a level of concern about burnout. I agree with you. And we'd always watch that to make sure that we, from frontline crews, we'd roster as best as we possibly can. And for the senior managers as well, we can't forget about them, because without them, the rest of the system doesn't operate. That we had to make sure that we gave them rest as best we possibly could as well. But in fairness, people were more eager to be there than not be there, if that makes sense to you. Keeping people safe with the PPE, welfare, etc., employment assistance programs, they're all made available and they're all sitting there and they can be accessed through ICT and Moodle sites at all times. So some of the challenges that we'd have maybe without COVID weren't actually there, right? And we just, in fairness, I suppose not up to me, but my job was to make sure that, you know, that the service was resourced enough and respected enough and kept safe enough for people to do their job. And that's what I'd be about, you know. Is that okay?
Fantastic. Thank you so much, Martin. And thank you for a fascinating afternoon of leadership lessons during your career, and also the lessons that you learned while studying at the Graduate School of Healthcare Management. I believe we might have one other question. Is that right? From Joshua. Does he have a question, Joshua, if you want to put it in the chat? Maybe not. Okay. We might leave it at there for now, folks. Thank you so much to Kathy for presenting. Always a great woman to have at the wheel. And also to Professor Robert McMurray. Thank you so much. And of course, to our guest of honour, Martin Dunne, current Deputy CEO of Lifeline Ambulance Services and a former Director of the National Ambulance Service of Ireland. So before we finish up, I just want to let people know that we are currently closing our applications for our postgraduate courses at the moment. The deadline is soon approaching. If you would like to apply for one of our master's programs, please contact us at leadership@rcsi.com. We will be more than happy to look after you. Today was the last in our series of webinars over the summer. We've had some very interesting lessons from a whole range of healthcare professionals, from former students to current students, alumni students, and special guest speakers such as Martin. And all these webinars are available on our YouTube channel, and we will be issuing recordings to all the registered attendees. So on behalf of myself and the team at the Graduate School of Healthcare Management, I'd like to thank you all for joining us today. And a special thank you to Martin. Lovely to see you doing so well in your career. And my special thanks to Kathy and to Robert as well. Thank you so much, everyone. Take care. Bye-bye.